Good morning. My name is Jaakko Aarnio. I am from DigiConnect, eHealth, Wellbeing and Aging Unit. I'm going to talk about two topics today. Digital health and care services, support for strategy and early adoption, which is a CSA. And another topic is digital health and care services leading to pre-commercial procurement. Then there will be other digital health related topics that deal with adoption and scale, and I only explain shortly them and give the titles at the end of the presentation. So the first topic, digital health and care services, support and strategy, support for strategy and early adoption. So the challenges are that the service providers and users are increasingly facing complex decisions that they need to address, and so there's also a need for support for cross-border collaboration, and then they need to balance the risks in innovation. Also, it's not has been not very clear how the strategies are evolving. So I think this CSA needs to also address the strategies and practices in a concerted manner, kind of integrated strategy approach. And we have witnessed that more confidence is needed and to address key areas of interventions. And the need to facilitate an appropriate dialogue seems evident, including the supply side and academic stakeholders. This CSA should create favorable framework conditions for cross-border communities of practice and assist the health and care research and innovation ecosystems in taking investment decisions. And improve the maturity of the new products emerging from Europe's leading health ICT companies. And it should support the management of risks and diverging expectations in innovation chain. Computer health can be interlinked within the institutional health and care. And the findings of earlier coordination support actions should be taken on board. This slide presents in a graphical form the structure of the CSA. So we anticipate parallel activities that are building up on the competencies and capacities of the network. At the bottom of the slide, we see the innovation chain axis that is characterized by the diversity and the maturity of key performance area matrix. And we perceive this activity to support the collaborative innovation and open innovation to concepts. The framework for thematic communities of practice in digital health and care services should focus, there are a couple of attributes. It should focus on user-driven elements, and then a cross-sectoral growth strategy, and then the integrating data strategy, which is very important. And what we have seen is that the research institutions and university hospitals need to be interlinked. And education elements and training should be taken on board. There are a couple of national initiatives that can be interlinked as well. And during the years, we have witnessed various methodologies that have been developed, and this CSA should consolidate the repositories of methodologies for health and care service actors. The development of key areas of interventions is important, and this is a strong upfront investment to facilitate the development much before the investment decisions are made. We have observed that there's a need for support for risk management. For example, value-based procurement belongs to that category, although it's not a part of any of the instruments or most of the instruments, but it could provide some help for the procurers at the later stage. So the support actions should also prepare at least one cross-border PCP. To facilitate the development of the key areas of interventions, obviously we need the market consultation situations. They are either open or closed. When the solutions become more mature, and then the closed market consultation practices will prevail. Now the instruments come into the picture, so there would be could be PCPs and PPIs or other instruments. So it's basically the support action supports all kinds of innovation activities. But in this particular context, the innovation procurement instruments are in focus. There is nothing preventing, for instance, the suppliers to apply money in other instruments, but this is a bit out of the scope of this CSA, but the ecosystem and the framework would actually facilitate the information, facilitate access to information that could be useful also for the supply side actors. So we need networking and also knowledge management to connect the dots. So the bidirectional arrow here represents knowledge management, and the one directional is the submission of a proposal. The yellow area represents the activities of the CSA. Everything that is in yellow belongs to the CSA. Expected impacts are, in a nutshell, they are related to the networking KPIs and frameworking. The purpose was is to support the ecosystems and the thematic areas. So we expect that there is a concerted approach and solutions to the challenges faced by the health and care ecosystems, and from the service providers and users' perspective. And then we also expect that the unmet needs are well addressed, and there will be reduced fragmentation. And so there should be also evidence of support and collaboration with consortia developing unmet needs for innovation procurement and implementation aspects beyond the innovation procurement procedures. And finally, a concrete preparation of a cross-border PCP. At least one of those should emerge from this project. The deadline is 24th of April 2018. The budget is 3 million euros, and the EC contribution a maximum of 100% of the total eligible costs. Now, next I'm going to present the PCP that is interrelated to the previous one, but because the process is not deterministic, so these two can be separate. And so the challenge is the same as in the previous one. So there's a pressure on governments, and then also there's a challenge to network, lead, and facilitate health systems research that address key areas of interventions in health and care services. And so this PCP should support the health and care service providers to procure industrial R&D services as usual in the process. And then the PCP should test and implement digital services and communication concepts that can facilitate the transition to integrated care models across health and social care services. I would like to mention in this context that this topic addresses the early adoption, and it's a lower part of the innovation chain. There are other topics that also address the integrated care models, and they're more on the deployment side and lower risk area for large-scale implementations. The key areas of interventions could be, for example, patient empowerment, self-management, patient safety, diagnosing, hospital and home care logistics, etc. And also the country-specific cross-institutional setups should be supported, and decentralized procurement environments and collaboration across institutions. The scope continues. So this should be driven by clearly identified user needs, and this demonstrates strong commitment of end users. The interoperability, ethical and privacy aspects should be covered, and then compliance with the procedures, and also implications for training is important. What we expect evidences in key performance areas, i.e. quality in health and care services, sustainability of the delivery system, and economic value. We also expect improved user and market engagement, strengthened procurement community, and evidence of benefits of disruptive technologies. And we also expect increased opportunities for solution uptake across wider international procurement markets by aiming at interoperable solutions. And of course, evidence of a healthy innovation ecosystem. The deadline is next year, 14th November. The budget is 22 million, 90% of eligible, maximum of 90% of the total eligible costs could be the EC contribution. And we recommend EC contribution of around 5 to 6 million euros, a decent contribution so that it can cover the development. But other amounts also could be applicable. And of course, this should follow the specific requirements for pre-commercial procurement supported by Horizon 2020 grants, as set out in the Annex E and D. So then finally, I'm going to present shortly the other topics that are related to adoption and scale. There are three topics. One is a support action that addresses digital health and care innovations as well, but in the context of digital single market strategy. So there are slightly different impact metrics, and they're complementary to this HCC-04. Then there would be another topic, large-scale implementation of digital innovation for health and care in an aging society. This is related more to the European Innovation Partnership on Active and Healthy Aging. Then we have one innovation action, 2019, which is a large-scale pilot of personalized and outcome-based integrated care. And then one focus area pilot dealing with smart and healthy living at home. Thank you very much for your attention.